Good afternoon to all of you. My name is Oshujan. Today's Vival topic is causality assessment. Is the method used to determining whether there is a causal relationship between a particular exposure, such as a drug or a chemical, and observe adverse events such as side effect or illness. It involves evaluations various factors to ascertain the likelihood to exposure causing the adverse event. Here's the details. Then temporary relationship. The first step is to establish the temporary relationship between the exposure and the adverse event. If event occurs shortly after the exposure and results upon discontinuations, it suggests a potential causal relationship. Then biological possibilities, assessing where there is no biological mechanisms by which the exposure could cause the adverse event. This involves understanding the pharmacological of substance and its potential effect on the body. Then dose response relationship, determining if the dose response relationship, meaning that the higher dose of the exposure are associated with a greater likelihood or severity of the adverse event. Then re-challenge, if feasible and ethical, re-administrating the exposure of C if adverse event resource, if event reappear upon re-challenge and resource again discontinuations. It strengthens the case of causality. Exclusive alternative expansion, ruling out the other potential cause of the adverse event such as contamination, medications, underlying medical conditions, or other exposure that could explain the observed effect. Then consistency with known effect, assessing whether the adverse event is consistency with known about the pharmacological effects to the exposure based on preclinical and clinical data. Then biological gradient, observing whether there is a biological gradient, meaning that greater exposure to the substance is associated with a greater likelihood or severity of the adverse event. Then specificity, consider whether the event is specific to exposure in questions, if could be attributed to their factors, strength of associations, evaluation strength, association between the exposure and the adverse event, including factors such as magnitude of the risks and the statistical significance of any observed associations. Then coherence, ensuring that the causal interpretations in coherent with what is known about the exposure, the adverse event, and the context in which they occur. By considering their factors, causality assessments aim to provide a systemic and objective approach to determining the likelihood of causality relationship between exposure and adverse event. Then temporary relationships, this involve establishment the sequence of event where the exposure precedes the adverse event. The timing between exposure and onset of the adverse event can vary depending on the substance and the nature of the event. In some case, the adverse event may occur immediately after exposure, while in other they may be delayed. Then biological possibility, this examines whether there is a known biological mechanism that could explain how the exposure could lead to observe adverse event. Then understanding the pharmacokinetics and how the substance is observed, distributed, metabolized and excreted, and the pharmacodynamics, how the substance interacts with the body, is a curricular in determining biological possibilities. Then drug response relationship, a drug response relationship strengthens the case for the causality if there is a clear relationship between the dose or level of exposure and the occurrence or severity of the adverse event. It suggests a causal associations. This relationship can sometimes be challenging to establishment. Then specificity, evaluating whether the adverse event is specified to exposure attribute to other factors, a specific associations between the exposures and the adverse event increase the likelihood of causality. Then strength of associations, it involves assessing the magnitude of the risks and statistical significance of any observed associations between the exposure and the adverse event. A strong association with high relative risk or odd ratio provide stronger evidence of causality coherence, ensuring the causal interpretation is coherent with existing knowledge and understanding of the exposure, the adverse event, and the biological mechanism involved. Thank you.